Medical revalidation of Puerto Rico. Diagnostic criteria for type 2 diabetes mellitus, DM2. Question 1. Diagnosis of diabetes mellitus. A 52-year-old man with obesity and hypertension visits his physician for a routine checkup. His fasting blood glucose is 130 milligrams per deciliter. He is asymptomatic. What is the most appropriate next step in confirming a diagnosis of type 2 diabetes mellitus, DM2? A. Start metformin immediately. B. Repeat fasting blood glucose test on a different day. C. Perform an HbA1c test. D. Order an oral glucose tolerance test, OGTT. Correct answer B. Repeat fasting blood glucose test on a different day. Explanation: DM2 is diagnosed if one of the following criteria is met on 2 separate occasions. HbA1c 6.5%. Fasting blood glucose FBS to 126 milligrams per deciliter. 2-hour glucose tolerance test, OGTT, 200 milligrams per deciliter must. Random plasma glucose 200 milligrams in a symptomatic patient. Since the patient has an elevated fasting glucose to 126 milligrams per deciliter, but is asymptomatic, the test should be repeated on a different day to confirm the diagnosis. Why not the other options? A. Start metformin immediately, not recommended without confirming the diagnosis. C. Perform an HbA1c test. While HbA1c can be used for diagnosis, repeating the fasting glucose test is the correct next step. D. Order an oral glucose tolerance test, OGTT. OGTT is not necessary if fasting glucose is already elevated. It is mainly used in borderline cases. Question 2. Random blood glucose and diabetes diagnosis. A 45-year-old woman with a history of obesity and polyuria visits the clinic. Her random plasma glucose is 210 milligrams per deciliter, and she reports increased thirst and urination. What is the most likely diagnosis? A. Impaired fasting glucose. B. Type 2 diabetes mellitus. C. Metabolic syndrome. D. Prediabetes. Correct answer. Type 2 diabetes mellitus. Explanation: diabetes is diagnosed if random plasma glucose is 200 milligrams per deciliter in a symptomatic patient, e.g. polyuria, polydipsia. No additional tests are required if the patient is symptomatic and meets the glucose threshold. Why not the other options? A. Impaired fasting glucose between 100 to 125 milligrams per deciliter, but this patient has random glucose 200 milligrams per deciliter. C. Metabolic syndrome includes insulin resistance but does not define diabetes. D. Prediabetes, defined by FBS 100-125 milligram or HbA1c 5.7 to 6.4%, but this patient meets the diabetes criteria. Would you like